Good afternoon, everyone. My name is Jordyn Schwerin. I am a Kinetiq Health Program Manager here at Apex Benefits. I am also a registered nurse by background, which has in turn made me very passionate about preventive health. So I'm excited to talk with you today and its importance for the well-being of our kids. So let's get started. Couple things to start off here. So webinar housekeeping. All attendees are going to be in listen only mode for the duration of the webinar, meaning your microphone is going to be muted. If you have any questions or concerns, please use the chat box located in the right-hand side of your webinar screen. For audio access, attendees can use their computer audio or call in using the phone option. Please ensure your speakers are on and adjust the volume accordingly. And lastly, today's presentation slides and resources can be downloaded by clicking the paper icon on the right-hand side of your webinar screen. Today, we're just going to be covering a variety of topics. What is preventive care and why it is important, what to expect with back to school physicals and screenings, how to prepare you and your child for annual vaccinations, reestablishing school routines, and general hygiene reminders. So what is preventive care and why is it important? Preventive care visits are most often routine doctor's appointments, typically done on an annual basis. These help encourage us to stay healthy and catch any health problems early. Essentially, preventive care covers everything from a flu shot to a standard blood pressure check. As adults, we are aware that kids' bodies go through so many changes as they grow and develop. Therefore, preventive care is going to be the best way to make sure that your children are healthy and reaching developmental milestones appropriately, as well as staying up to date on routine vaccinations and being knowledgeable about day-to-day safety information. All of this is done to make sure that they are ready to hit the books this time of year. Back to school physicals. So with the importance of routine physicals and screenings, it's important to plan ahead. Lord knows that once the school year starts, our family schedules quickly fill up with soccer games, dance recitals, field trips. So it's important to schedule these appointments and routine vaccinations before the start of the school year. These appointments oftentimes fill up quickly. So when you go this year for your appointment, make sure to get a date on the calendar for next year. You can always adjust it later on if something comes up, but it helps to prioritize those appointments for the next year. So what do these typically look like? Typically, a nurse or medical assistant will come in and get your child's height and weight, assessing their growth against the average growth of other children their age. They'll also check their vital signs like heart rate, blood pressure, temperature, and then also review their scheduled immunizations to see if they're due for any new ones this year. Then the doctor will come in and they will assess how the last year has been and have any questions for you, addressing any concerns you may have, any conditions that your child has had before, any medications they're taking. They're going to review all of that and just see how they are doing. They will also do an assessment. So they will listen to your child's heart and their lungs. They'll look in their eyes, ears, mouth, and nose. They will also assess posture, joints, strength, and flexibility. This is often the time that your doctor will also assess the curvature of your child's spine to assess for any risk of scoliosis. And then again, they will review that age-appropriate safety information for your child. So sports physicals, let's see here. So if you mention it before the day of your child's appointment, you can often get sports physicals done with their annual visit, depending on the doctor's office. So contrary to popular belief, sports physicals should be done with each new season of a sport, regardless of whether your child has played it for the last 5 years or it's a brand new sport that they are trying out. This is going to be when the doctor assesses risk of asthma or asthma exacerbations. And they also assess your child's risk of injury pertaining to that individual sport and your child's current health. So make sure that it is safe for them to play new sports, current sports, by getting those sports physicals done each year. So as you can see, there is a lot of information that can be covered in these visits. It's easy to get overwhelmed while trying to navigate questions and concerns. I know that I've gone to the doctor and it's only been me in that appointment, and I still continue to forget things that I wanted to bring up to them. Thankfully, the Mayo Clinic is very aware of this, and they developed a list of helpful questions you can ask yourself before your child's appointment. Feel free to write answers to these down and have that piece of paper with you at the appointment. So these questions cover a variety of topics covering digestive problems, any concern about pain or fatigue. Has your child reached any important developmental milestones on time? Has your child's eating habits changed? Are they seeming anxious or depressed? Unfortunately, with the last couple of years of COVID, it is not uncommon for kids right now to be having some anxiety or depression with going back to school. So you can always reach out to your school social worker or counselor, or even talking to the primary care provider about your concerns with that. And then assessing, is your child sleeping well? Are they staying asleep throughout the night? Are they waking up a lot? This can also be an indication of if they are anxious or depressed. But overall, I want you to know that you know your child best. You see them the most, you interact with them the most, more than any provider can know and will know in a 1-hour visit each year. So your thoughts and concerns are going to be some of the most important things you talk about in this appointment. So vaccines, most schools will require your children to be up to date on their vaccines at the start of the year. Now, this has been a really hot topic in the past, and COVID did not help matters at all. But according to UMR, vaccines protect against many diseases that used to be more common. This includes tetanus, measles, pertussis, meningitis, and polio. These infections have led to serious and life-threatening problems in the past, and thankfully, due to the wide availability of vaccines, many of these illnesses have been rare for years. So vaccines are going to give us the ability to afford protection against many of these life-threatening illnesses by being exposed to a very small quantity of a virus or bacteria. This is going to be the smallest amount possible to trigger an immune response in our bodies to formulate those antibodies. This way, your body can develop an immune response without the serious life-threatening problems that can come from encountering the disease without a vaccine. Overall, the American Academy of Pediatrics, the Centers for Disease Control and Prevention, and the National Academy of Medicine all conclude that the benefits of vaccines outweigh their risks. Now, one of the most common side effects after a vaccine is developing a fever, because when our bodies are working hard to make antibodies, our temperatures can rise. Essentially, a fever can serve as evidence that the vaccine is working. Now, not everyone develops that after a vaccine. All of our bodies are different, and that's okay. It doesn't mean that the vaccine isn't working. But many people become concerned when their children have fevers, because these can often rise pretty quickly. So make sure to speak with your child's doctor if you have concerns about this, or if they have had anything like a febrile seizure before. Great questions to ask include who to call and what temperature reading to call about, and when it is appropriate to give your child a non-aspirin anti-fever medication. So this will be medications like Tylenol or ibuprofen. As a side note, a lot of parents will ask if they can give their child Tylenol or ibuprofen before a vaccination, thinking that it could help with pain during or after the injection and preventing a high fever. Unfortunately, although I understand the rationale behind this, it is not recommended to give a child these medications before a visit, just because this can actually decrease their immune response. So make sure to speak to your healthcare provider about when to give that non-aspirin Tylenol or ibuprofen after the vaccination. Honestly, in most cases, a child doesn't need to be medicated for their fever unless they are extremely uncomfortable or they've reached a temperature reading that the doctor warned you about that hey, this is when you can give that ibuprofen or Tylenol. Go back here for a second. But just make sure to speak with them and discuss that with them. And then hydration is going to be one of the most important things with fevers, just making sure that you are encouraging your child to drink water after a vaccination. All right, so you may be asking, what vaccinations does my child need? This will all depend on your child's age and what vaccines they have already received. Vaccine schedules have been developed based on the average child's immune response at various ages and how likely they are to be exposed to that disease at their age. So that's going to be maybe through daycare, school, or just day-to-day public activities. So you can find an updated vaccine schedule on the CDC website. They actually update the schedule every 12 months, and it is accessible to everyone just going to that website. On this next slide here, I actually have an example of a vaccine information statement. This is a document that you can find on the CDC website. It's produced by the CDC themselves, and it helps to inform vaccine recipients, parents, and guardians about the benefits and the risks of a vaccine that they or their child is receiving. It also has some information on the disease that that vaccine is protecting against, any risks associated with that vaccine, and any additional information about concerns about adverse reactions. The biggest takeaway that I would love for you guys to take from this section is just to make sure that you are consulting with a licensed medical provider about any questions or concerns that you may have with vaccines or with your child. I assure you that us healthcare professionals have heard it all. So just make sure you're talking to your doctor about any concerns that you may have. So oftentimes this can be when we feel the most helpless as guardians and parents, because vaccines, regardless of your age, can be scary and uncomfortable and sometimes painful. But according to this little chart that we made here, it can be helpful before, during, and after a vaccine to have some things in place. So beforehand, for kids of any age, honestly, bring a comforting item, whether that's a stuffed animal, a book, maybe if it's a teenager and it's just their cell phone and being distracted by that. It can be helpful to have something that they can hold on to when they are getting that vaccine. Older kids above 4 or 5 years old, it may be helpful to explain to them what to expect. So if you compare the vaccine to something that they felt before, like a poke or pressure, and then emphasize that that feeling isn't going to last longer than maybe a day. In some cases, also beforehand, you can call the doctor's office, and there are sprays and ointments that can help numb the area of where a vaccine is given. Now, this isn't available everywhere, but it can be worth asking if it is available. During the vaccine, the most helpful thing is to realize that your child will often feed off of how you are reacting. It's difficult to hide our emotions. I am aware of this during this time, but maintaining eye contact with your child, talking with them is going to be helpful. Not looking at the shot if you get a little queasy with needles, but just reminding them that you're there with them and that they're going to be okay is going to be helpful. Also, a little tip here, deep breathing, especially for older kids, going in through the nose, out through the mouth, helps to physically relax the body. This is also really going to help relax the limb that that vaccine is going to go in. And then you're not going to have as much pain during the vaccine and for as long after the vaccine. So little nurse tip there, try and make sure that arms or legs are relaxed for the administration of that vaccine. Afterwards, for babies, it can be helpful to breastfeed or bottle feed. It can help calm them after having the vaccine. For kids underneath 2 years old, you can ask for something sweet. This will actually help to reduce their pain response, which was something I found really interesting doing the research for this. And then otherwise, just monitor your child for side effects, monitoring for rash or fever. monitoring for any soreness. Sometimes a cold, damp cloth can help with that. And then again, just making sure you're hydrating after that vaccine. All right, so now moving on to screenings. Vision plays an extremely important role in your child's development and their learning ability. It's the primary way that your child takes in and learns about the world around them. And according to the CDC, about 1 in 4 preschool-aged children have undiagnosed or untreated vision problems in the US. So when they're at home, make sure to pay attention to patterns like squinting, rubbing eyes, trouble concentrating, any pain in the eyes. That can be really helpful to realize, hey, maybe something's going on here. Yearly vision screening is also encouraged. These are often done at schools by the school nurses, so maybe just checking in with them that they do that each year. If not, it's easily something that can be done again at that annual physical. But keep an eye out for if those vision screenings are worsening. And then if they are, you can always go to an ophthalmologist or optometrist to get a treatment plan for your child. So that's going to be involving like a prescription for glasses or contacts. And that's kind of the order of events there. But studies have found improvement in learning, testing, class participation, and self-confidence after kids have eye exams and treatments. So it's really important. So protecting our vision is going to be important for kids, especially nowadays when computers, TVs, and phones are constantly accessible for their little eyes to be looking at. So it's important for us to continue practicing care for our eyes to help prevent damage in the future. There are 4 big ways to help with this. Eating a healthy and balanced diet that has high foods in vitamins and antioxidants. So this will be things like green leafy vegetables, fish, eggs, carrots. Those will all be really good for our eye health and vision. Second is going to be limiting screen time. Too much screen time has been shown to contribute to obesity, inadequate sleep, behavioral problems, and attention problems, along with struggles with eyesight. So in general, we should be helping our kids to limit screen time and take breaks with any near vision activities. Reading or looking at objects can really bring on some eye strain and fatigue, which leads me to the third thing, going outdoors. It is healthy for our eyes to get a break from those near vision activities, and going outdoors and looking at objects in the distance is a great way to recover and prevent eye strain and fatigue. Even after this presentation, preferably not now, but if you can go outside, look at something in the distance, you will actually physically feel your eyes relax. So it's really good practice to have even in your workday. And then lastly, wearing sunglasses. It's going to be protection against those UV rays and radiation from the sun. So making sure you are wearing those sunglasses. All right, and then dental health. One of the most common diseases in childhood is tooth decay and cavities. More than half of adolescents have a cavity in at least one of their permanent teeth, which is crazy. Thankfully, cavities are preventable. So eating good sources of calcium like low sugar yogurt, broccoli, and milk will be helpful, as well as encouraging water over high sugar beverages. So hydration is going to be really important. Again, I emphasize it throughout this presentation, but choosing water over soda, over juice, even Gatorade is really high in sugar. Helping to bring down those added sugars in our beverages can help to protect the enamel on our teeth. For babies, any child that is under 1 year old or hasn't had their teeth come in yet, just wiping their gums twice a day with a soft and clean cloth until their teeth start to come in, and then they will go to the dentist by the time they are 1 year old. And then for children older than 2, encouraging them to brush their teeth twice a day, and then visiting the dentist every 6 months for their annual cleaning. All right. So with vacations, nannies, and more time at grandma's house, our schedules can be all over the place throughout the summer months. And it's important that we get our kids back into a more normalized school routine. I know that the transition from summer activities to the classroom can be kind of frustrating to kids. They're not running around or exercising as much as they were in the warm summer months. So try to help them get 60 minutes of exercise throughout the day. If they have 30 minutes of recess, maybe trading 30 minutes of screen time, watching the TV, to go outside or play outside. I apologize about the slides, but just trying to make sure that they are getting outside for about 60 minutes a day. And then eating a high protein breakfast. So a well-balanced breakfast with protein has been proven to promote children's focus in school. So many schools have breakfast programs for students if needed for busy mornings or getting out the door, don't have time to make anything, just prioritizing that high protein intake. Evening routines are another big thing as we go back to school. And it can be helpful to even cut your child's screen time before they go to bed. Usually about an hour before bed is encouraged, just because the blue light that reflects off of our TV, our phone screens, it actually suppresses melatonin, which is a chemical in our brain that signals that we're sleepy. So by removing those screens an hour before bed, it helps with that melatonin production. Easy ways to do this include keeping screens out of bedrooms, keeping TVs out of bedrooms, and encouraging kids to charge their devices outside of their rooms, maybe in the kitchen overnight. During this time, they can take a shower, they can put on comfy PJs and relax a little bit. And this can be a really good time to connect with your child, maybe reading to them at night. I know younger kids usually enjoy more picture books, while other children that are older maybe enjoy chapter books. So this can just be a good time to connect with your child at the end of the school day. Continuing to establish new routines. So if your child is going to a new school or the same one, try to visit the campus with them before their first day of school. Help them figure out their routes to get to classes, where their homerooms are, even meeting with their teachers. This can all really help to relax any anxiety or worries they have with going back to school. Sometimes children have trouble adjusting when they go back to school, right? We're coming from the summer months, a lot of different schedules. And again, 2020 and COVID did not help with our stress and anxiety. So you can connect, again, school social worker or counselor. And if not, you can always speak to your child's primary care provider. And then lastly, homework expectations, just reestablishing these with your kids. For example, are they expected to come straight home and work on their homework before dinner and have it done? Can they start it after dinner? This can just help them reorganize themselves for a routine. All right, and lastly, I wouldn't be doing my due diligence as a nurse if I didn't have at least one slide as a reminder for the importance of washing your hands. So washing your hands is going to be one of the most effective ways to prevent the spread of germs and sickness. So make sure to remind children about washing their hands and when it is important to do so. So this will include before they go to lunch, after sneezing or blowing their nose, after going to the bathroom, and after playing outside for recess or just in a general public space. So that is all that I have for you guys today. If you have any questions about the content that was covered, please feel free to connect with me at the email address listed. And we appreciate your engagement and hope to see you next month for our next Kinetiq Health monthly webinar. Have a great rest of your day.